Welcome everyone. In today's video, we are going to talk about tip to apex distance, which is used to assess the position of the lag screw in the fixation of intertrochanteric fractures. So, the tip to apex distance is described as the sum of distance from the tip of the screw to the apex of the femoral head on AP and lateral views. So to make the apex of the femoral head, we draw a line along the axis of the femoral neck through the center of the femoral neck. And the point where it cuts the head is the apex. Similarly, we draw it in the lateral view also. Now we get the distance from the tip to the apex on the AP view as XAP and on the lateral view as X lateral. Now, the tip apex distance is given as the distance between the tip of the screw and apex on the AP view and the lateral view. Now, if the X-ray is in 100% magnification, this is the tip apex distance. However, most X-rays will have some degree of magnification. So we have to multiply it by the magnification correction coefficient. To calculate the magnification correction coefficient, we have to divide the true diameter of the screw, which we already know, by the diameter in the particular view. So in the AP view, it is D true by DAP. And in the lateral view, it is D true by D lateral. So in this way, we get the tip apex distance. The ideal tip apex distance is less than 25 mm. And the tip apex distance method emphasizes a central position of the lag screw. That is, central position in the AP view and central position on the lateral view. A newer measure is the Calcar referenced tip to apex distance. Now this method emphasizes the inferior position of the lag screw on the AP view and a central position on the lateral view. The logic behind this is that lag screw can get better purchase in the thick calcar bone region if we place it slightly inferiorly. And also it will prevent varus collapse better. So in this method, the lateral distance is calculated in the similar manner. But for the AP distance, a line is drawn parallel to the femoral neck. So along the axis of the femoral neck, you draw a line, but it just touches the calcar rather than going through the center. It is a line that is just touching the calcar. And now from the tip, we get the distance as XAP. And similarly, we make the calculation and get the tip to apex distance. The normal Calcar reference tip to apex distance is again less than 25 mm. However, some studies say that up to 35 mm is also acceptable. So friends, in this video, we discussed the tip to apex distance and the Calcar reference tip to apex distance. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.